Mandibular neck. It is a thickening of the joint capsule, and acts to prevent posterior dislocation of the joint. Sphenomandibular ligament originates from the sphenoid spine, and attaches to the mandible. It limits distension of the mandible in an inferior direction. Stylomandibular ligament, a thickening of the fascia of the parotid gland. Along with the facial muscles, it supports the weight of the jaw and limits mandibular movements, such as preventing excessive opening. TMJ disorders includes myofascial pain dysfunction syndrome, internal derangement, degenerative diseases. Other disorders, ankylosis, dislocation and fracture. Myofascial pain syndrome. It is a chronic pain disorder. In this condition, pressure on sensitive points in your muscles, trigger points, causes pain in the muscle and sometimes in seemingly unrelated parts of your body. This is called referred pain. Symptoms: deep, aching pain in a muscle. Pain that persists or worsens. Difficulty sleeping due to pain. Risk factors: muscle injury, stress and anxiety. Treatment: pain relievers and muscle relaxants, antidepressants, sedatives, physiotherapy, massage, exercises and heat. Before explaining the difference between two types, the thing you should remember: in a normal joint, the thin intermediate zone of the disc is always interposed between the condyle and the temporal bone during all phases of opening and closing. This is to protect the articular surfaces when the joint is in function. The constant contact of the condyle with the intermediate zone. There will be no friction between the condyle and the articular fossa. In anterior displacement, the disc is positioned anterior and medial to the condyle in closed mouth position. In anterior displacement with reduction, we can see the disc is placed anterior to the condyle in closed mandible. During opening, the condylar head make friction with the disc while the retrodiscal tissue pulling the disc slightly backward to normal position. This friction causes the clicking sound. So this type of displacement called with reduction because the disc restored to its normal position in opening mandible. There is no limited mouth opening in this type of displacement. In anterior displacement without reduction, the disc placed anterior to the condyle head in closed mandible. During opening, the disc interfere with the condyle and cannot return to normal position. So the mandible cannot open the full range, causing limited mouth opening without clicking sound. So the difference between two types: with reduction characterized by clicking sound during opening, without reduction characterized by limited mouth opening. Degenerative diseases. The most common diseases which can affect TMJ are osteoarthritis and rheumatoid arthritis. Rheumatoid arthritis is an inflammatory autoimmune condition that occurs when your body's immune system mistakenly attacks its own cells. RA commonly affects joints throughout the body, including the